While my patient was entering the room, I assessed her gait, which was regular and tandem. I also previously got vital signs, which included blood pressure, heart rate, pulse ox, temperature, respirations, height, weight, and BMI. Hi, my name is Natasha. I'm going to be your nurse practitioner today doing your assessment.
Okay.
As I go through each of her body systems, I'm going to be inspecting the skin for color, temperature, moisture, texture, edema, turgor, bruising, scars, lesions, and nevi. When you inspect her hair, you notice that it is coarse. It's evenly distributed upon the head. It's gray in color. As I assess and palpate the scalp, I'm looking for any kind of depressions, lesions, masses, infestations, and also, is it tender at all?
No.
I'm going to palpate the temporal pulses, or the temporal artery. Is that tender at all?
No.
Okay. And then I'm going to do our lymph nodes, which are the pre-arcular, the post-arcular, the occipital, the mandible, the submental, the tonsillar, the anterior cervical, the posterior cervical, and the subclavicular. Okay, I'm also going to palpate here. Does this hurt at all?
No.
Okay, can you bite down for me? Is that tender?
No.
That's assessing cranial nerve 5. Can you blow your mouth, or can you purse your lips for me? Can you blow your cheeks out for me? Can you smile for me? Can you frown for me? Can you raise your eyebrows for me? That's assessing cranial nerve 7. Next, I'm going to do, can you feel this?
Yes.
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 Can you feel this?
Uh-huh.
I'm going to touch your arms and legs with sharp and dull, and I want you to tell me if it's sharp or dull.
Okay. Soft. Sharp. Soft. 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 Sharp. Soft. Sharp. Sharp. Soft. Sharp.
Okay. Next, I am going to look at her ears. When I'm assessing her ears, I'm assessing for the pinnae and tragus for masses or any tenderness. Is this tender at all?
No.
I'm also going to inspect the inner ear and the tympanic membrane. And both of the inner ear canals are without erythema or any kind of exudate, and her tympanic membrane are clear and opaque. Next, I'm going to place this on your head. I want you to tell me when you don't hear the vibration anymore.
Okay. Now.
Okay, and again.
Now. Now.
And one more time.
Now. Now.
Okay, and then I'm going to ask you to do the same with your hands and your ankles. You let me know if you don't feel the vibration anymore.
Now. 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 Now.
Okay. Now I'm going to whisper something in your ear, and I want you to tell me what I say.
Eight. 8.
Okay, and now I'm going to start looking at her eyes. I'm going to look at her eyelashes and her eyebrows, and also her palpebral fissure, and they're all intact and normal. Now I'm going to get you to remove your glasses, and I'm inspecting her conjunctiva and sclera, which were without drainage and are pink and moist. Next, I'm going to do her perla of her eyes. Both are 3 millimeters and reactive to light. Then I'm going to get her to put her glasses back on and look at this eye chart. Can you read the lowest line for me?
DEFPOTEC.
Okay. And that is 20/20 vision on the eye chart. Now I'm going to get you to focus here for me and cover your left eye. Okay, now I want you to cover your right eye. So her eyes are without extraocular movement or strabismus. Now I'm going to get you to follow my hand and let me know when you can see, or I'm going to get you to tell me when you can see my finger.
Now. 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 Now.
Okay? And I want you to look straight at me and I want you to follow my finger with your eyes only. Okay? Next, I'm going to look at the eye for her red eye reflex. And I'm going to start at about 12 inches away until I can see it. And her eyes were reactive with the red eye, and also I saw partial retina in both eyes. Next, I'm going to inspect her breathing, and it does not look like she's labored, and no nasal flaring. Then I'm going to look at her nasal passage in her nose, which seems symmetrical between both ears. I'm also going to check for patency for that. So can you blow out for me? Can you blow out for me? And I'm going to look in each nair, which are patent and without redness. Next, I'm going to palpate her frontal sinuses and her maxillary sinuses. Is that tender at all?
No.
Okay. Then I'm going to get her to open her mouth for me. And her teeth are without any cavities. Her palate and mucosal membrane inside her mouth is clear of any kind of redness or lesions. Can you stick your tongue out for me? Can you move it to the left? Can you move it to the right? Can you move it up? Okay. Her salivatory ducts are intact. Her posterior pharynx is is pink without any kind of redness or exudate. Her tonsils are not present due to removal as a young age. The tongue floor of her mouth, or her tongue and the floor of her mouth are all pink and moist without any kind of lesions on them. Now I'm going to check for TMJ. So I'm going to ask you to open your mouth, move your jaw to the left, move it to the right, and shut your mouth. Does any of that hurt?
No.
I felt no subluxation or crepitus and no pain upon palpitations. Now I'm going to get you to stick your tongue out. The tongue is in midline of her mouth without fasciculations, and her uvula, can you say assess it? It rises with wording. And can you say dog?
Dog.
And also her palate moves with vocalization. Okay, next we're going to assess her throat and her neck. So the trachea is in the midline of her neck. We're also going to auscultate the carotid arteries bilaterally. And no bruise noted bilaterally. Next, we're going to get her to push up against my hands with her shoulders. Okay, and sugaring without resistance, so that's cranial nerve 11. Now can I get you to roll your neck back and forward, left side and right side? Okay, so she has good movement of her neck as well. Next, we're going to get her to turn around, and we are going to start assessing her posterior back. It is symmetrical. Can you take a big deep breath? It rises and falls appropriately. The patient does not appear to be in any respiratory distress. There's no deformities. It's symmetric. I'm also going to get her to say 99 for me as I go down to check for fremitus.
99.
Again.
99.
Again.
99.
Again.
99.
There was no tactile fremitus noted. I'm going to now percuss over her lung fields. Let me know if it hurts at all. Any pain with that?
No.
Okay, now I'm going to auscultate her lung fields. Take a big deep breath for me. And again. One more time. Okay. 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 Again. 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 Okay. Again. 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 Okay. Now I'm going to get you to say E for me.
E.
Again.
E.
Again.
E.
Okay.
E.
Okay. Now can you whisper a word for me? Again. Again. Okay. Can you say that word out loud now?
Dog.
Okay.
Dog.
Okay.
Dog.
And that was just checking for any kind of consolidation within the lungs, doing the acaphony, the bronchophony, and the whisper pictologlath. Next, we're going to get the patient to turn back around. And again, we're inspecting for any deformity or symmetrical problems, which there is none. We're going to again assess for tactile fremitus. So say 99.
99. 99. 99. 99.
And I do not see or do not palpate any tactile fremitus. Now I'm going to auscultate her lung fields as well on the front. Can you take a big deep breath? Okay. Again. 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 Okay. Her lungs are clear bilateral, posterior and anteriorly in all quadrants of the lung. Next, I'm going to auscultate her heart sounds in all 5 points. First, I'm going to do it with my diaphragm. And I'm doing the aortic, the pulmonic, the Erb's point, the tricuspid, and the mitral. Okay, and I'm going to do it again. And I hear S1, S2 with no murmurs noted. I'm going to now try to palpate the apical pulse. And I'm unable to palpate the apical pulse, so now I'm going to listen for an apical pulse. Her apical pulse is 61 beats per minute. Now I'm going to have the patient lie down for me. At this angle at 30 degrees, her JVD is absent. I'm also looking for any heaves or lifts, which I do not see. I'm also going to palpate over her heart to feel for any thrills at any point. And I do not feel for any thrills at any point. Now I'm going to inspect the abdomen, which seems rounded and flat. I'm also going to auscultate for her abdomen arteries, which includes the aorta, the renal arteries, the iliac arteries, and the femoral arteries, which I do not also hear any bruise. Now I'm going to listen for bowel sounds in all 4 quadrants. And her bowel sounds are active in all 4 quadrants. Now I'm going to palpate the abdomen for any tenderness. Does that hurt at all?
No.
Okay, no tenderness in her abdomen. Now I'm going to get you to take a deep breath in while I try to assess for the liver and the spleen. And the liver and the spleen were also palpated. Next, I'm going to move to her upper extremities, so you can sit back up. First, I'm going to have you place your hands out for me and close your eyes. I'm going to place something in your palm, and I want you to tell me what it is.
a key, I think.
It is a key. Keep your eyes closed. Tell me what that is.
Some sort of round disc.
Yes, it's a coin. Okay, so that was tracking the Venus. Now I'm gonna make a a number in your hand. You tell me what it is.
6.
It is 6, and that was checking for graphthesia. Now I'm going to go ahead and look at her hands, inspect them for any kind of nodules, edema, redness, swelling. And they look normal with no edema, no nodules, no swelling. Okay, can I get you to move your thumb up, your thumb down, your thumb left, your thumb right? Does any of that hurt for you?
No.
Okay, now I'm going to get you to do your wrist up and down, left and right, and then in a circular motion. Does that hurt for you?
No.
Okay, and then I'm going to get you to pull against me, and I'm going to have you push against me. Does that hurt at all?
No.
Okay, she's got normal strength in her wrists, in her hands. I'm going to check her capillary refills in her hands, which are normal in less than 3 seconds. I'm going to go ahead and check her capillary refills in her feet, which are also less than 3 seconds. I'm going to feel for her pulses in her feet. And they are both 2 pluses and present bilaterally. Okay, next I'm going to get you to roll your arms for me, your shoulders bilaterally. Does that hurt?
No.
Go back with them, front with them, okay? And go up with your arms and down with your arms. Does that hurt at all?
No.
Okay, now I'm going to ask you to go back and forth with your hands like this for me. Okay, and now I'm going to get you to go and can you take your fingers and touch your feet and move back up and touch your feet. Can you do it with this hand? Okay. And now I'm going to get you to, can you move your ankles for me? Up, down, left, right. Your toes. Can you wiggle your toes for me? Does that hurt at all?
No.
Okay. I'm going to get you to stand up for me. And I'm going to get you to move your hip to the left. Move your hip to the right. I'm going to get you to go in a circular motion. Does that hurt at all?
No.
Okay. And then I'm going to get you to lean down. And I'm going to assess her spine. There's no evidence of scoliosis or kyphosis. Okay. And can you hop on one foot? Can you hop on the other foot? Okay. And you can sit back down. Now I'm going to check for deep tendon refluxes. And I am going to first, does that hurt?
No.
Okay. Okay, and now I'm going to get you to lie down. I'll get you to put your feet out. Okay, and I'm going to help you sit back up. Okay, can you bend your arms out for me? Can you bend your arms in for me? Is that painful at all?
No.
Okay, and I'm going to get you to bend your arms out for me and in for me. Is that painful at all?
No.
Okay. Okay, baby.